Good evening and welcome to Image Builders Presents Conversation with Michael Carson. I'm your host, Michael Carson. You've tuned into our weekly Facebook Live and YouTube broadcast, which is produced by men and for men. For those of you that are joining me on YouTube, please click the subscribe button and also that notification bell so that you are able to know when our next show is and who our guests will be. We are here every Thursday night at 7 p.m. Eastern, right here on Facebook and on YouTube. Tonight's show, as you see across the screen, is being sponsored by Stephanie Hudson, who's a realtor from Better Homes Gardens Metro Brokers. Tonight's show, we're also going to deal with COVID. We have two distinguished guests. I'm so honored to introduce them to you. But before we do that, let me introduce again our sponsor. Our sponsor this evening is Stephanie Hudson, as I mentioned. Stephanie is known to be resourceful about what's going on in the community for clients, friends, family, and neighbors. She considers herself the resourceful realtor who is always identifying areas for friends to purchase a home. Her clients appreciate the hand-holding as they go through the home buying and home selling process. She is a member of the Atlanta Realtors Association and serves on the Gubernatorial Affairs Committee and is also a member of the National Association of Real Estate Brokers. Her belief is helping to empower people with their God-given gifts so that they can use them to their full potential. Again, I am pleased to announce our sponsor for tonight's show, Realtor Stephanie Hudson. Her information is on the screen if you need her services. The real estate market is hot in Atlanta. If you are selling a home, it is definitely a seller's market. If you're buying a home, expect to pay more for that home here in Atlanta. But thank you, Stephanie, again, for sponsoring tonight's show. And we look forward to working with you more in the future. Recently, we marked more than 500,000 deaths here in the United States due to COVID-19. And most of those individuals who have died have been people of color, Latinx, Black Americans, and Asia-Pacific Islanders and Native Americans. So tonight we wanted to talk about COVID-19 in the Black community. And I couldn't think of two better people to talk about it than my friend, Dr. Clinton Carter. And he said, if you're going to have me on, you got to have my better half, Dr. Denise Carter, on. So I'm like, yes. So thank you, Dr. Denise. I mentioned to her before the show that she is the first woman on our show, and I'm grateful to have this husband and wife dynamic duo. Harvard, Harry College, Dr. Denise, I was looking at credentials, New Jersey Medical and Dental, St. Peter's College University. They are, they know their stuff. So I'm not bringing you guys some doctor that's on the corner selling, stuff out of a bottle, trying to tell you what to do. So Dr. Denise, Dr. Clinton, thank you guys so much for being here. Let's get into our conversation. Tell us your story. Why did you both become doctors?
Denise?
Okay, so I became a physician after going through an arduous route of trying to decide what I do, or actually having the courage to do what it takes to become a physician. When I developed that courage, then I went forward, and it was nonstop. But it's always my ambition to help people, to inspire people to take good care of themselves and to live healthy lives.
Yeah. Yeah, for me, I kind of knew at an early age, I used to always follow the pediatrician around and, interested in science. Didn't know where exactly it was going. Had some experiences growing up, seeing people that needed help. And then we had, I had medicine in my family. My father was a dentist, my mother was a science teacher. But then just letting the God flow through and find out what was really on my heart to do. And it just like my wife said, just led me back to a position of helping people and bringing health to the forefront when doing that. So that was my man.
So who pushed you to Harvard?
Nobody. Me.
Oh, okay.
Yeah, it came down to a choice between Harvard and Morehouse. Actually, I'd gotten in a few other schools, MIT, a few other schools, but it was really, I wasn't expecting to get into Harvard, and I got in. And so I said to myself, first, my brother had also gone. At the time, I just said, how many African Americans get into Harvard?
Mm-hmm.
And so it must have been a purpose there for me to be in that space. And that's what I learned was.
So how many African Americans were in your class at Harvard?
I don't remember the class size, but they always touted that we were at 10%, but we were more like 7%. I think we had, it was about 50 in my class, because our class size wasn't that much, so like 500.
And Dr. Denise, you have medical and dental. Did I read that correctly?
No, the school is actually a medical school and a dental school. Okay. University of Medicine and Dentistry. Mm-hmm.
So you said finding the courage. How does one find the courage to say they want to become a doctor? I mean, what is that? What is that mental gymnastics like, if you will?
Listening to, I'm a very spiritual person. I do believe in being guided, and it's listening to the guidance within. My initial degree was in business. I came from a poor neighborhood, not many role models. So it was a journey in really finding that place within myself that I credit to God to give me the confidence, the courage, the self-determination, the understanding of who I am to do it. Because, we're told other things. Society tells us other things about who we are and what we're capable of doing. So I had to overcome a lot of that internal turmoil to grow.
So were you two married at the time, or you met after you became doctors?
So we met. So initially I was going to do head and neck surgery. So I had to go to Howard to do general surgery for a year, which is considered internship. And that's where I met this wonderful debonair man. But we met at Howard University. Mm-hmm.
Oh, right. Excellent. So let's dig into COVID a little bit. I mean, historically, if you're watching us tonight and you don't know, historically, African Americans and medicine haven't always been the best combination, if you will. We can talk about the Tuskegee syphilis experiment, as well as Black women who were being experimented on by a guy who is known as the father of gynecology to kind of test their, because he thought Black women were superior to pain, like they couldn't feel pain, so they weren't given anesthesiologies. And then in our communities, we don't have a lot of hospitals. We don't have a lot of access to health care. So here we are in the age of COVID. And it's, as I mentioned earlier, over 500,000 deaths as a result of COVID. And our community seems to be affected more greatly than others. Why is it that the African American community is affected the way it is due to COVID? Either one of you can.
There are a diversity of reasons. One is the low socioeconomic status. You have situations where people live together, more so people live in a small area together. Another is access to health care. So there are a lot of reasons. And I have to mention Morehouse, which is where I trained in family medicine. But I'm just so proud of the leadership at Morehouse. That's their whole mission, is to help with the inequalities in healthcare. So there are a lot of things going on to help that process and to help get better access to healthcare, better access to vaccines.
Mm-hmm. Yeah, in addition to what I've said, the socioeconomic disparities don't allow African Americans access automatically. And then we're also frontline workers, which is not always healthcare. We look at the grocery stores, and et cetera. So we find ourselves in that population of people in a lot of times more condensed areas, especially like in the New Yorks and the urban setting. And leads to an increased opportunity for us to be exposed to this virus and also just in general to the other healthcare disparities we have. And then also we have increased comorbidities, diabetes, et cetera. And so with that exposure, that just increases increases immediately. But the economic disparities play a significant role in us not being able to attain the type of care that we need to fight off something like this.
So it's been, I think it's almost been a year. Next month will be a year since we were notified that it was here. What strides have been taken in the medical field over the past year? I mean, I know there's been, now that you guys have been able to work with it or see what it is or see kind of what it's doing, what are some of the strides that you guys can talk about in the medical profession dealing with COVID-19?
Well, it definitely changed the workforce. So we do a lot of telehealth medicine now, and I don't think that's going away. I think it opened up a whole new realm. So we do a lot of telephone work with patients. At this point, we're seeing patients on a few days, but most of the patient care is still via telehealth.
And then, so how are you able to tell them if someone was to call you and say, "Hey, I'm experiencing symptoms of COVID. What should I do?" And I know initially it was like, "Don't come to the hospital. Come to the hospital. Wait till you've had it for a few days." What are doctors telling individuals? Now that we know more about it.
Well, to still stay home, but if you experience any shortness of breath or any warning signs like inability to stay awake or blue lips or to indicate that you're not getting enough oxygen, then you need to seek medical care right away. Those who do have symptoms, we have set up situations where they can be tested outside of the facility, so they're not coming in exposing everyone.
Dr. Clinton, are you still doing emergency care work? Are you still working in emergency rooms?
No, I don't. I came out of the emergency medicine realm.
Okay.
But I still do urgent care, but I'm a director of a med clinic, and so even though we are not the primary, the first exposure, we still do have a lot of exposure from people coming in. During COVID, we actually saw a downward trend, and then all of a sudden, as the people started needing jobs, we were getting a lot more patients come in than were expected. And so I don't do the emergency medicine, but I understand. And it is, my heart goes out to the emergency medicine personnel and the hospital personnel, and not just the physicians and not just the nurses, everybody there, the clean and the administrative assistants, because they're there and they're being exposed. But then for the healthcare workers, they're seeing a lot of just morbidity and deaths that, I mean, as an ER doctor, we had to get used to. And I don't know if you ever get used to being able to see people transition. And but the way they're transitioning now without their loved ones and all that, it is taking a toll. I just saw a few articles where some of the nurses are starting, and some of the personnel they're having to stop because they just cannot manage. It's basically PTSD because it's just like you're at work all day and all night. Then when you go home, you're still living it. So I really have a lot of respect and send a lot of healing energy to them.
Mm-hmm. So are there have groups developed as a result of it, out of it, to help the frontline nurses or the frontline workers, whereby they can get the mental health care that they need during this process? Or is it just not enough time for them to do it because they have to be on call all the time? Or for the most part, they're always going? So are there outlets for frontline workers, hospital staff workers, where they can get the help they need?
Yeah, they have them. I'm not familiar with them, the exact names, but they have, and they have them right there in the hospital settings,
Okay.
and outside of there. The challenge that most of the healthcare workers are having, they just don't have time to do it. I mean, working like 18-hour days or days on end. They might work 4 or 5 days at a time and then get just a few hours break, and then they're right back at it full steam. So hasn't been a lot of time for them to do that. That's why it's a lot of emphasis being put on getting this vaccine done, because the healthcare system is not going to be able to take being taxed this hard too much longer. And that we haven't even started talking about the financial system.
Right.
I mean, effects that is going to have on hospitals soon, if not already.
So early on when we heard about COVID, the former president was calling it the China flu and the Wuhan flu, and it came from Wuhan, whatever. But since then, we've heard about different strands of it. So I think there's one from Europe, one from Brazil, and other places. What does that mean for just the average? If a person hears there's a strand of it, does that mean that it's something that we here in America aren't capable of dealing with, or is it something new, some new and improved virus? Can you explain what that means?
Sure. Denise, I'll take this first this time. So what we found is, and barring the politics around this was the response to a virus or an attack from something of this nature was not performed at the level that it normally is from the public health realm. So this virus was allowed to just expand and to flow. Now, we could have had the same thing happen with the flu if everything wasn't going on like the influenza virus. So once that starts happening, it is basically unbridled, and it's allowed to expand and to proliferate at its own pace with no controls. And so when that happens, the virus just starts doing what it's known to do, and just like humans do, it just survives and keeps living. And every time you try to do something to stop it, it's going to change itself so it can survive the next stressor that comes on. And that's what we're seeing. It started, that's where the variants come in. You start seeing you see things that come in that you say, wow, why is it changing? It's because it's just trying to survive, and it's going to continue to survive. That's why it's very important to get these vaccines started, and we'll talk more about that. But getting the vaccines in and completed. We can't have a partial completion on the vaccines, because if you do, the same thing will happen with what happened with the flu, influenza about a couple of years ago. I don't know if you remember, we had a flu, people were getting flu vaccines, and then all of a sudden there was this uptick because an influenza B mutated, because it got used to the viruses to get used to the vaccine. So the vaccine had to be adjusted. We are behind that curve. So we got to catch up to that curve and then take off. So that's what's going on from that standpoint. But yeah, we are far behind, unfortunately, and that's why you see the big surge.
Okay. All right, so we catch up. So we're starting to do surveillance of all these variants, and that's what will allow us to catch up. Some preliminary studies are showing that the vaccines are effective or possibly effective against a lot of the variants. So that's good news. The other good news is that since vaccination has really catapulted, a lot of the cases are going down, which is great news. But we still, of course, in spite of that, have to practice the precautions that we all know to do now.
So let
me add something there, because like my wife said, they're starting to go down because of the variants, and because of the data, trying to keep up with the data. They're actually just in the past day or so started seeing another rise. And they're getting concerned. They're getting concerned about that. That is starting to to expand again.
Is that in certain demographics,
No,
certain states, or just across the board?
They're seeing it across the United States, period. But it was also in, and I don't want to call it wrong country, it's one of the European countries. They saw the same trend. It was the same trend was falling off. So I'll have to get that information back to you.
Okay, so one other question about the virus itself, and then we'll transition into talking about the vaccine. Recently, I heard Dr. Fauci on MSNBC talk about a monoclonal antibody, and that's where I guess if they're able to give it, he's saying you should get it right away if you've been tested positive for COVID to help you not go into a severe stage of COVID. Can you explain what that is, what that means?
Yes. So monoclonal antibodies are antibodies that are made in the lab to help the immune response to the to the coronavirus. Okay. So I know that Grady Hospital right now is offering monoclonal antibodies, and actually is a big push because there's a large supply of it and people aren't utilizing it. The people that will benefit from it are those who have mild to moderate disease. And that will help keep them out of the hospital.
So how do you get, so do you go, when you go to the hospital, do you ask for it, or is it a preventive?
I guess it depends on where you go, because if they don't have it there, you can't get it. I just know I'm a part of the Grady system, so I know Grady offers it. So we have a protocol to send out patients if they have early symptoms.
Okay.
Yeah, that was a big push, Mike, about Fauci and the CDC for people to actually ask for it, to start saying, I want to have it, because it hasn't become a mainstream approved, it's approved, but it hasn't been marketed as a cure-all for disease. So it's kind of in a fluctuation point right now. So it's some of the advertisement has to come through the patient and say, I want this. Because it does stop people from having to have to stay in the hospital. That's what's important.
That's the key.
Okay.
It prevents, once you get it, they have done studies where they show that it has been a significant decrease in the amount of severe cases. And that's what you're concerned about. It's not whether or not you get the mild symptoms, it's if you get the severe symptoms that we're concerned about.
Excellent, excellent. For those of you that are just tuning in, you're tuning in to Conversations with Michael Carson. I'm here tonight talking about COVID-19 with my special guests, Drs. Clinton and Denise Carter. Also, our show tonight is sponsored by Stephanie Hudson from Better Homes and Gardens Metro Brokers. And again, Stephanie, we thank you for your sponsorship. So I want to transition to the vaccine. So this is where I stand on the vaccine. If I could have got it last year, I would have got the vaccine last year if it was available. Because I don't want to hear a rapper, an athlete, TV personality tell me don't get a vaccine. I don't want to hear. I'm not listening to those folks. And I beg people, do not listen to those folks. They are not doctors. They are not scientists.
Right.
And I know there's the Pfizer, the Moderna, and I think there's one more, Johnson &
Johnson.
They're coming out with one that's one shot and not two. I saw some numbers today that the over 65% of seniors have now been vaccinated, either with the first shot and or the second shot, which are promising numbers to me. And I spoke with a distant cousin earlier, and she told me her mom is 90, I want to say like mid 90s, but she's had both shots with no side effects.
Great.
So let's talk about the vaccine. And I think there's not enough being done to market the importance of the vaccine in our community. So let's talk about it. What do you guys think about it? I know President Biden's only been in office 38 days or whatever. But I think there has to be more marketing to our community. What are your thoughts about all of the noise about the vaccine in the Black community? I know that's a broad question, but
Well,
specifically as it pertains to whether you should take the vaccine or not.
Mm-hmm.
yeah. Yeah, I think I agree. It's a lot of noise. It's dangerous and damaging because if you can take a vaccine that can prevent severe illness or prevent death versus having symptoms maybe the following day. I mean, granted, we don't know the long-term effects, but vaccines are generally safe, but they'll be studying, we're learning. But the risk benefit ratio is just huge. I'm
Mm-hmm.
glad that you are a figure on the radio promoting the vaccine. Thank you. Because we are really pushing that. I myself had the Pfizer, my husband had Moderna. I had side effects after both, and that's because the first vaccine I had, the side effects both were about a day, but I had a fever, your body aches, just a day or so, but it's gone after that. So I just think it's so dangerous not to get the vaccine, especially for our community who really need it. And I hope that I understand that the governor is trying to work with Morehouse and other organizations to really get the vaccine out into the communities of need as ours. So I'm hoping when the next big influx of vaccines come, which should be soon, that he follows his word and we get a significant portion devoted to our neighborhoods.
Yeah, Mike. It's tough for the African American community. Like you talked about the Tuskegee experiment.
Yeah.
We see a lot of things going on socially now that are exposing the concepts of, racial disparities very, very prominently. And so it makes it hard for our community to trust. When we need things,
if I may, is some of that also driven by people who just found out about this and now they're on social media and have a platform, and then they're saying, well, what about the Tuskegee syphilis thing? And then they're not putting out, they're putting just enough information to not give people all of the information they need so that they can make an informed decision.
I think some of that's there too, Mike, but just as an African American, it's hard in situations, even in our professional situations. There's just a disparity. The equality is not always there.
Yeah.
I can give you stories being an African American physician where you would say, well, I'm sure that's not happening in that. It does.
Mm-hmm.
And so it gives us some pause when it comes to all of a sudden this mass influx of vaccines. But the thing is that's important for everybody to understand. We're already in the middle of it. It would be a different story talking about the beginning. Like you said, it's over how many? 500 million people?
500,000
people that have died. And I have a friend who was from New York when it first started out. He had 5 people that was close to him died that in 1 week.
Wow.
From COVID. And, some people say, well, it wasn't COVID. They're making numbers up. We know people. We have people in our family that transition. So when you start thinking about that, it gets down to, okay, you may have a conspiracy theory in your mind, but when it gets down to the facts, people are dying from this.
Yeah.
The way you spread this is from having the virus in your respiratory system and allowing it to get into someone else's.
Yeah.
That's the bottom line. You can get it in your tactile through your fingers, but that's the major way. So if you can say, go see your grandmother, go see your aunt, go see relatives or people you don't know, meet them in the shopping center and say, well, I don't mind giving you an opportunity to die. That's what it comes down to being, to me. Yeah. And I think that's where we need to really help push through the African American community, that we need to, based on what we talked about earlier, we are in a place of inequality, and so it takes a more push to get us to where we need to be. And we do not need to be dying, or it doesn't make a difference anyway. We're not going to be able to change anything in our society for us if we're not here, or if our loved ones are not here. So that's where the vaccine becomes very important right now.
And Doc, to your point, I saw some statistics earlier that says that 65% of non-Hispanic white individuals have received the vaccine, where everybody else is down in the teens, and they're 65%.
Right. Absolutely.
They're not dying at a higher rate.
Absolutely.
And there are people who are paying. I've seen reports of people who are paying to jump over other people so that
they're doing it. And then when you put the graphs together, the people are getting it or not. You know, you're showing the death rates are lower. So that in itself, not unless you're ready to kind of annihilate a certain number of our population, we have to do something about it. And to get rid of the virus, you need to get the vaccine, or either get it and don't die.
True, and that's a huge risk.
Yeah, that's a huge risk.
You don't know how it's going to affect you.
Right.
And then you think about not just getting it and having severe disease or dying, right, but the people who have sequelae or consequences from getting it. A lot of people aren't well after having it for months.
Right. Yeah. You heard in the last administration this concept of herd immunity.
Yes.
Vaccines are what herd immunity does without you getting the virus.
Okay.
What they do with the vaccine, people may not know, they're not injecting the virus into your body so your immune system will build up antibodies against it or attack it. What it's doing is they take a piece of the virus that is important, and then they develop the antibodies from that. Mm-hmm. They put that in your body. They put the protein that they take from the virus and put it into your body. It can't proliferate. It can't make other viruses. And then what happens is your body attacks it.
Yeah, and that's what I heard somebody explain it. Like you get the vaccine now recognizes what the virus is. So when the virus comes back, the vaccine knows, this is what it is. And so it defends. It's a defense mechanism for you because it can recognize what the virus is.
Absolutely.
Real quick, the way I like to explain to people is like if you have a house, right, and you have these closets in your house, and you have a burglar come through the door, and the burglar comes through the door, then all of the security people that you didn't know there came out and they attacked the burglar. So when the burglar comes, you get more of them to come out, and there. So it's kind of like that scenario for your body.
So we're in phase 1A or phase 1, I think, where the vaccine has been given to individuals 65 and older, doctors such as yourself, or people. When do we transition to the next phase, or is that based on the amount of vaccinations that are available?
I think it's based on availability.
Okay. And we anticipate that being when?
Well, they are looking to have, they said, 130 million vaccines available by the end of March. That's what the Biden administration's last words were on that.
Yeah, but they were falling. They were falling short. Like the Johnson & Johnson, it will probably be approved sometime this week. Vaccine shipped next week, but it's a lot lower than what was anticipated. Right. But by a few months down the road, with the way the Biden administration is running, we should have plenty down the road. But it's a little rough right now.
See, what they did is they opened up the pharmacies to give it now, like Walgreens.
Yes.
Not this Friday, I think it was last Friday. Now it's still not there. So you run into things about transporting it, having it available. I want to make a comment too about the vaccine. So you'll see numbers. They'll say the Moderna and Pfizer are 95% effective, but then this new one that's coming out, Johnson & Johnson, is 65%.
Yeah, I've seen that.
It's about that. There's some things that they're finding out about the Johnson & Johnson. One it is actually done well against the variants. It's doing so far. They're finding out. The other thing is it is good because against the severe illnesses, people who are at risk of severe illness, it is stopping like 85% of that. So that's huge right there. And then it's one dose, but that's a convenience factor more there. But that's something that to look forward to if it works the way it's supposed to.
Okay. We will wrap up this conversation. I have one or two more questions. For those of you that are watching this program and you do not live in Atlanta or in Georgia, don't come here. I know we're open, but don't come here. Atlanta, I mean, I know the All-Star game is coming up. And they have it
here? I thought they were questioning it.
Well, it's still kind of quick, but they built some type of entertainment center for people to gather, which, it's weird and it doesn't make sense. We're in the middle of a pandemic, but people are still coming to Atlanta. They're flocking to Atlanta because the state is open, unlike California and other places. So I think it's don't come here. Do what you can. Make sure you wash your hands, social distance, get the vaccine. Any other advice you guys would give as we close this out with respect to COVID? I'll leave it up to you.
I would just say, just reiterate what Mike just said about practicing social distancing, washing your hands, wearing your mask, double your mask if you can't wear an N95 mask. And then find moments in life that you can enjoy and as best you can. Try to still eat healthy to keep your immune system strong and exercise, because that will help you to stay strong and fight illnesses that come your way.
So vitamin D, vitamin C, the elderberry. I mean, my wife has 10 different berries.
Yes.
Garlic. Yeah. There's a lot of things. They have Jamaica has this little COVID cocktail that they make. It's got a lot of things that people don't like, but they just take.
Do you guys make your own COVID cocktails since you brought that up?
Well, we make our healthy cocktails. I make a green drink with organic ingredients, but we've been doing that. And actually it really works well for us and has been keeping us healthy.
Right. We take vitamin C and garlic every day.
Yeah.
Okay.
So we are.
Okay, so it's vitamin, I'm vitamin D deficient, and I take a lot of vitamin D.
Yeah.
So should I be taking vitamin C too? Doc, I got to come and get you to examine me and get me on the manual. I don't know about doing the garlic thing every day, but.
Yeah, that's good if you're not on a blood thinner.
That's right. And you could do odorless gel caps.
Mm-hmm.
Oh, okay.
Yeah.
Yeah. Well, one final question before we close this out and jump onto Instagram. Valentine's Day was just the 14th. Dr. Denise, did he come through or did he fall short?
My baby always comes through.
Oh, okay.
So of course we had to contain it, but yeah, I mean he comes through not just for me, but for our 3 daughters. We have a son and 3 daughters. Well, it's not just me, believe me. They get theirs too. So he always comes through. Yeah. He's
so Doctor, you have your assistant taking care of it, or you right there in the mix?
Say what now?
Assistants take care of you in the mix.
No, these are real women. There's no assistants. Either you doing it or it's not gonna work.
Okay. Yeah. Well, again, thank you guys from bottom of my heart. I really appreciate you on the show tonight. Dr. Clinton and Dr. Denise Carter, husband and wife dynamic duo, who are serving our community here in Atlanta and doing an excellent job. Hopefully you've gained a lot of information from tonight's show. Feel free to reach out to me at info@imagebuilders, imagebuilders.com. If you'd like to reach out to Dr. Carter, I can plug you into both of them so that you can get more information about COVID or your healthcare needs. Again, we thank you so much to our sponsor tonight, our first sponsor, Stephanie Hudson, who's a realtor here in Atlanta, who's an excellent realtor, excellent knowledge if you're looking to buy or sell a home. Her information is on the screen please feel free to reach out to her. We're going to jump off this live and we're going to go to Instagram. If you have an Instagram account, follow us on Instagram. Follow me at Michael Carson Jr. on Instagram, and we're going to continue this conversation with Dr. and Mrs. Carter. Thank you again for joining us tonight. Continue blessings, and we look forward to seeing you on next week's broadcast next Thursday night. Take care.
Thank you for having us, Michael.
Thank you guys for being.
Appreciate it. And anytime you need us, we can come back.
Yes, sir. Thank you.